So there were 344 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 p.m, and there were no overseas cases reported. 119,256 tests. There are 62 cases in ICU, and again, are quite a young profile. 3 in their 20s, 7 in their 30s, 6 in their 40s, 14 are in their 50s, 13 are in their 60s, 16 are in their 70s, and 3 are in their 80s. It is also important to know that 57 people in ICU, 57 of that 62 are not vaccinated, and 5 people have received 1 dose of the vaccine. So you can see that the vaccine works. We haven't got anyone in ICU that has received the 2 doses of the vaccine, and even the pattern, we would have expected, proportionate to vaccination status, those people not to be in ICU with the one dose. So even one dose does afford protection. In terms of the deaths, sadly we've had the 2 deaths, and as the Premier has indicated, there's a gentleman in his 30s from Northern Sydney who died in the Northern Beaches Hospital yesterday. He was not vaccinated, but had some significant underlying health conditions, and also a man in his 90s from southwestern Sydney died at Concord Hospital. And can I just pass on my sincere condolences and sympathies to their loved ones. In terms of the key messages for today, it is to mirror what the Premier has said. We are seeing some pleasing improvements in Fairfield and some stabilisation in Canterbury-Bankstown. It takes a while, but it does show that with that strong community response, with everyone working together, we can actually stabilise and turn around an uptick in cases, an upswing, and bring that down. But what we are seeing is the growth of case numbers in other areas, and we need to redouble our efforts in those areas to achieve the same impact that we've seen in the Fairfield area in particular. So, for instance, the inner west, the areas around Cumberland are still very high, Bayside, Georges River, particularly the edges of those suburbs that border onto the affected suburbs, and Strathfield as well. And as the Premier's indicated, we're watching those closely. So it is important that everyone knows that there is an increase in cases in those areas, and for them to come out and get tested and assist us with control. In terms of the Hunter cases, yes, there were 14 new cases across Hunter, New England. The majority of those cases are linked, but some are still unlinked, and those unlinked cases are the ones that concern us most. Central Coast has already also reported 2 new cases, and they're still under investigation, but preliminary assessment does indicate that both of those cases travel outside the Central Coast, and so preliminary information is that they probably acquired their infection outside the Central Coast. But again, we ask the Central Coast community to be very vigilant and come forward for testing. In relation to DUBBO, there is 2 confirmed cases that came in, a lady in her 40s and a household contact, a young child, and those, because of those cases, we've recommended a lockdown which the government has put into a place. It is critical that that lockdown is complied with in DUBBO, and even though it comes into at 1 o'clock today, we are asking people to make those decisions and act in a way as if it is in place at the moment. Also, we would like to see increased testing opportunities, and locally those testing opportunities have been stood up. Thank you.